Question 1. A patient on hemodialysis reports severe muscle cramping and dizziness during the last hour of treatment. The nurse notes a significant drop in blood pressure. Which intervention should the nurse prioritize? A. Administer a prescribed antiemetic. B. Decrease the ultrafiltration rate and administer normal saline. C. Increase the dialysate temperature. D. Elevate the patient's feet and continue current settings. Answer B. Decrease the ultrafiltration rate and administer normal saline. This question tests understanding of common intradialytic complications, specifically hypotension and muscle cramps, and appropriate nursing interventions. The keywords severe muscle cramping, dizziness, and significant drop in blood pressure strongly indicate intradialytic hypotension, which is often caused by excessive or rapid fluid removal. Decreasing the ultrafiltration rate slows down fluid removal, and administering a small bolus of normal saline helps to increase intravascular volume, both directly addressing the underlying cause and symptoms. For example, if a patient's blood pressure drops from 140/80 to 90/50, these interventions are crucial to prevent further complications. When patients show signs of hypovolemia during dialysis, remember that slowing fluid removal and replacing volume are key steps. Question 2. A nurse is performing a post-dialysis assessment of a patient's arteriovenous fistula, AVF. Which finding would indicate a potential complication requiring immediate intervention? A. A soft thrill palpated over the access. B. Absence of a bruit on auscultation. C. Warmth and slight redness along the access site. D. A compressible pulsatile mass just above the anastomosis. Answer B. Absence of a bruit on auscultation. This question evaluates the nurse's ability to assess a mature AVF and identify signs of potential failure or complication. The keyword immediate intervention emphasizes the urgency of identifying critical findings. A healthy, patent AVF should have a palpable thrill and an audible bruit, which are signs of adequate blood flow. The absence of a bruit suggests a significant reduction or complete cessation of blood flow, possibly due to thrombosis or severe stenosis, requiring urgent evaluation to preserve the access. For instance, if you hear no whooshing sound over the access, it indicates a problem with blood flow. Always remember that a functioning AVF needs both a thrill and a bruit to confirm its patency. Question 3. During routine water testing in a hemodialysis unit, the technician reports a breakthrough of chloramines in the effluent of the primary carbon tank. What is the most appropriate immediate action for the nurse to take? A. Continue dialysis treatments as scheduled, but retest in 30 minutes. B. Switch to the secondary carbon tank, if available, and replace the primary tank. C. Notify the medical director and document the finding. D. Increase the flow rate through the primary carbon tank to improve removal. Answer B. Switch to the secondary carbon tank, if available, and replace the primary tank. This question assesses knowledge of water treatment safety, specifically the critical role of carbon tanks in removing chlorine and chloramines, and the appropriate response to a system failure. The keyword breakthrough of chloramines indicates that the primary defense against these harmful substances has failed, posing a severe risk of hemolytic anemia if dialysis continues. The immediate action is to protect patients by ensuring adequate filtration, which means switching to a functioning secondary carbon tank, if present, and addressing the failed primary tank. For example, if the primary filter isn't working, you must use the backup immediately to prevent patient harm. Always remember that patient safety from water contaminants takes precedence, so promptly address any breakthrough with backup systems or by discontinuing treatments. Question 4. A patient undergoing hemodialysis develops sudden onset dyspnea, chest pain, and a feeling of impending doom. The nurse notices the bloodlines are partially empty and there is air in the venous line. What is the priority nursing intervention? A. Administer oxygen and place the patient in Trendelenburg position on their left side. B. Stop the blood pump, clamp the venous line, and administer a bolus of normal saline. C. Increase the dialysate flow rate to clear the air from the system more quickly. D. Recirculate the patient's blood through the dialyzer to remove the air. Answer I. Administer oxygen and place the patient in Trendelenburg position on their left side. This question tests the nurse's ability to recognize and respond to a life-threatening complication, an air embolism. The keywords sudden onset dyspnea, chest pain, feeling of impending doom, and air in the venous line are classic signs of an air embolism. The priority is to prevent more air from entering and to trap the existing air bubble in the right ventricle, keeping it away from the pulmonary artery. Placing the patient in Trendelenburg, head down, on their left side helps achieve this, while administering oxygen supports ventilation. For instance, if you see air in the venous line and the patient has these symptoms, immediately position them this way and give oxygen. Remember, for a suspected air embolism, the primary goal is to trap the air and support the patient's oxygenation. Question 5. Which of the following is the most important long-term advantage of an arteriovenous fistula, AVF, compared to an arteriovenous graft, AVG, or central venous catheter, CVC, for hemodialysis access? I. Easier and quicker cannulation. B. Lower risk of infection and thrombosis. C. Greater blood flow rates for more efficient dialysis. D. Shorter maturation time before use. Answer B. Lower risk of infection and thrombosis. This question focuses on the advantages of different vascular access types, a core concept in dialysis care. The keyword, most important long-term advantage, directs attention to the sustained benefits of AVFs. While AVFs might take longer to mature and can be challenging to cannulate initially, their primary long-term advantage over grafts and catheters is a significantly lower risk of complications like infection and thrombosis. This reduced complication rate leads to fewer hospitalizations and interventions, improving patient quality of life and longevity. For example, a patient with an AVF is less likely to develop bloodstream infections compared to someone with a CVC. Always encourage AVF placement whenever possible, as its superior long-term safety profile makes it the preferred access. Question 6. A patient on peritoneal dialysis presents with cloudy effluent, abdominal pain, and a fever of 115 degree F, 38.6 degrees C. The nurse suspects peritonitis. Which diagnostic test is most crucial to confirm this diagnosis? I. Abdominal X-ray to check for bowel perforation. B. Complete blood count, CBC, to assess white blood cell count. C. Effluent cell count with differential and culture. D. Blood cultures to identify systemic infection. Answer C. Effluent cell count with differential and culture. This question assesses the nurse's knowledge of diagnosing peritonitis in peritoneal dialysis patients. The keywords cloudy effluent, abdominal pain, and fever are classic signs of peritonitis. While CBC and blood cultures provide general information about infection, the most definitive diagnosis for peritonitis relies on analyzing the peritoneal effluent itself. An effluent cell count typically showing greater than 100 white blood cells per cubic millimeter with at least 50% neutrophils and a positive culture confirm the diagnosis, guiding appropriate antibiotic therapy. For instance, without the effluent analysis, you might treat for peritonitis based on symptoms, but the exact bacteria and its sensitivity might be missed. Remember, cloudy effluent, especially with pain and fever, means you need an effluent analysis to properly diagnose and treat peritonitis. Question 7. A patient with end-stage renal disease, ASRD, on hemodialysis has a serum potassium level of 6.2 milliequivalents/L. Which of the following dietary instructions is most appropriate for the nurse to provide? I. Increase intake of lean protein sources like chicken and fish. B. Limit consumption of high potassium fruits and vegetables such as bananas and oranges. C. Ensure adequate intake of calcium-rich dairy products to balance electrolytes. D. Emphasize fluids to help excrete excess potassium through urine. Answer B. Limit consumption of high potassium fruits and vegetables such as bananas and oranges. This question tests the nurse's understanding of dietary management for hyperkalemia in ESRD patients. The keyword serum potassium level of 6.2 milliequivalent/L indicates hyperkalemia, a dangerous condition that can lead to cardiac arrhythmias. Since the kidney's ability to excrete potassium is severely impaired in ESRD, dietary restriction is critical. Foods like bananas, oranges, potatoes, and tomatoes are high in potassium and must be limited to help manage this. For example, advising a patient to avoid orange juice and choose apples or grapes instead directly addresses the high potassium. Always educate patients on identifying and avoiding high potassium foods to prevent life-threatening cardiac complications. Question 8. What is the primary reason for administering erythropoiesis-stimulating agents, ESAs, to patients with end-stage renal disease, ESRD? I. To prevent secondary hyperparathyroidism. B. To reduce the risk of cardiovascular events. C. To treat anemia caused by decreased erythropoietin production. D. To improve bone mineral density. Answer C. To treat anemia caused by decreased erythropoietin production. This question assesses knowledge of medication management in ESRD, specifically the purpose of ESAs. The keyword primary reason guides the focus to the main therapeutic goal. In ESRD, damaged kidneys produce insufficient erythropoietin, a hormone essential for red blood cell production, leading to anemia. ESAs, like epoetin alpha or darbepoetin alpha, replace this missing hormone, stimulating the bone marrow to produce red blood cells and thus treating the anemia. For instance, if a patient's hemoglobin is consistently low and ESA is prescribed to raise it, remember, ESAs directly combat the anemia of chronic kidney disease by replacing the kidney's natural hormone production. Question 9. A hemodialysis patient develops diffuse urticaria, pruritus, and dyspnea shortly after the initiation of a new dialyzer. The nurse suspects an anaphylactic reaction. What is the immediate priority intervention? I. Administer intravenous diphenhydramine. B. Stop the dialysis treatment and discontinue the blood lines. C. Slow the blood pump speed and monitor vital signs closely. D. Increase the ultrafiltration rate to remove the allergen more quickly. Answer B. Stop the dialysis treatment and discontinue the blood lines. This question describes a classic acute allergic reaction, likely anaphylaxis, during hemodialysis and requires immediate intervention. The keywords diffuse urticaria, pruritus, dyspnea, and shortly after initiation of a new dialyzer strongly point to an acute hypersensitivity reaction, potentially to the dialyzer membrane or sterilant. The immediate priority is to stop the exposure by discontinuing the blood lines and returning the patient's blood, if safely possible, to prevent further allergen introduction. Administering medications comes after stopping the reaction's cause. For example, if a patient suddenly breaks out in hives and can't breathe well at the start of treatment, the first step is to get them off the machine. Always remember to immediately stop the treatment and remove the allergen source in a suspected acute allergic reaction. Question 10. Which action is essential for the nurse to perform immediately after obtaining a blood sample from an arteriovenous fistula, AVF, needle in preparation for dialysis initiation? I. Flush the needle with heparinized saline. B. Secure the needle with tape. C. Obtain a second blood sample for routine labs. D. Connect the arterial bloodline to the needle. Answer D. Connect the arterial bloodline to the needle. This question focuses on the critical steps in initiating hemodialysis, specifically after cannulation and blood sampling. The keyword, immediately after obtaining a blood sample, implies the next step in preparing for treatment. Once initial blood samples are drawn to ensure proper lab values or for facility protocols, the arterial bloodline must be promptly connected to the arterial needle. This connection allows for the initiation of blood flow from the patient to the dialyzer, starting the treatment process. For instance, after drawing your pre-dialysis labs, you attach the red bloodline to the arterial needle, ensuring proper connection to the machine. Remember, after successful cannulation and drawing labs, connecting the bloodlines is the next step to start the dialysis treatment. Question 11. A patient on hemodialysis reports increasing pain, swelling, and redness at the cannulation site of their arteriovenous graft, AVG. Upon assessment, the nurse notes purulent drainage. Which type of infection is most likely occurring? I. Bacteremia, systemic infection. B. Cellulitis, localized skin infection. C. Abscess, a collection of pus. D. Access site infection, which could lead to bacteremia. Answer D. Access site infection, which could lead to bacteremia. This question assesses the nurse's ability to identify and understand the potential progression of vascular access infections. The keywords increasing pain, swelling, redness, cannulation site, and purulent drainage are classic signs of a local access site infection. While cellulitis and abscess are possible forms this infection can take, the term access site infection encompasses these localized issues and highlights the critical risk of it progressing to bacteremia, a systemic blood infection. For example, if a patient's graft site looks infected, it's a local problem that could soon become a whole-body infection if not treated. It's crucial to recognize that an infection at the access site is a serious localized issue with a high potential to spread systemically. Question 12. During hemodialysis, the arterial pressure alarm repeatedly sounds with a reading becoming more negative. The nurse has checked the arterial line for kinks and repositioned the patient's arm. What is the next most likely cause to investigate? I. Venous needle dislodgement. B. Clotting in the dialyzer. C. Stenosis, narrowing upstream from the arterial needle within the access. D. An air leak in the venous line. Answer C. Stenosis, narrowing upstream from the arterial needle within the access. This question tests the nurse's troubleshooting skills for a common dialysis machine alarm. The keywords arterial pressure alarm, repeatedly sounds, and reading becoming more negative indicate increased resistance or suction on the arterial side. While kinks are an initial check, persistent negative arterial pressure alarms, especially after checking the line, often signify a problem within the access itself, specifically a stenosis, narrowing, upstream from where the arterial needle is placed. This narrowing makes it harder for the blood pump to draw blood, creating more negative pressure. For example, if you've checked the tubing and it's clear, the issue might be a narrowing in the patient's fistula or graft that the needle is trying to pull blood from. Always think about the entire blood path when troubleshooting alarms, considering problems in the access itself. Question 13. A patient on hemodialysis has a severely itchy skin rash. Which laboratory value is most likely contributing to the symptom? I. Low serum albumin. B. Elevated serum phosphorus. C. Decreased hemoglobin. D. Normal parathyroid hormone, PTH. Answer B. Elevated serum phosphorus. This question assesses the nurse's understanding of the relationship between laboratory values and common uremic symptoms. The keyword severely itchy skin rash points to uremic pruritus, a frequent and distressing symptom in ESRD patients. Elevated serum phosphorus levels are a primary contributor to this pruritus, often leading to calcium phosphate crystal deposition in the skin and associated with secondary hyperparathyroidism. While other factors can contribute, hyperphosphatemia is a key driver. For instance, if a patient's phosphorus is consistently high, they often report intense itching. Remember, high phosphorus is a common culprit behind the intense itching experienced by many dialysis patients. Question 14. What is the primary purpose of adding bicarbonate to the dialysate solution in hemodialysis? I. To prevent blood clotting in the extracorporeal circuit. B. To remove excess fluid from the patient. C. To correct metabolic acidosis in the patient. D. To supply essential electrolytes for patient repletion. Answer C. To correct metabolic acidosis in the patient. This question targets the fundamental principles of dialysate composition and its therapeutic role. The keyword primary purpose directs attention to the most important function of bicarbonate. Patients with kidney failure frequently develop metabolic acidosis because their kidneys cannot excrete acid effectively. Bicarbonate in the dialysate diffuses into the patient's blood, acting as a buffer to correct this acidosis and restore the body's pH balance. For example, without bicarbonate in the dialysate, a patient's blood pH would become dangerously low. Understand that bicarbonate is crucial for buffering the acid buildup common in kidney disease. Question 15. The nurse is preparing to administer an iron sucrose infusion to a hemodialysis patient. Which action is most important to perform before administering the iron? I. Administer a phosphate binder. B. Check the most recent hemoglobin level. C. Review the patient's most recent transferrin saturation, TSAT, and ferritin levels. D. Obtain a signed consent form for the infusion. Answer C. Review the patient's most recent transferrin saturation, TSAT, and ferritin levels. This question assesses the nurse's understanding of appropriate monitoring for iron administration in hemodialysis. The keyword most important emphasizes the crucial pre-administration check. While hemoglobin is important, TSAT and ferritin levels are specific markers of iron stores and iron availability, which guide the need for and safety of iron therapy. Administering iron when these levels are already high can lead to iron overload, which has its own set of complications. For example, if a patient's ferritin is already very high, giving more iron could be harmful. Always ensure you check the specific iron status markers, TSAT and ferritin, before giving intravenous iron to prevent both under- and overtreatment. Question 16. A patient on continuous ambulatory peritoneal dialysis, AD, reports feeling full and bloated, and the nurse observes incomplete drainage of the dialysate. What is the most appropriate initial nursing action? I. Instruct the patient to try ambulating or changing position. B. Clamp the catheter to prevent further drainage. C. Increase the next fill volume to push out the remaining fluid. D. Administer a laxative immediately. Answer I. Instruct the patient to try ambulating or changing position. This question addresses a common issue in peritoneal dialysis, poor drainage. The keywords feeling full and bloated and incomplete drainage indicate a potential mechanical issue with fluid flow. Often, the catheter tip can become occluded by fibrin, omentum, or simply by the patient's position. Encouraging ambulation or changing position can often shift the catheter or move any surrounding tissue, facilitating better drainage without requiring invasive interventions or medication. For instance, if a patient drains only 5 liters of a 2-liter fill, having them walk around might help drain the remaining fluid. Always try simple, non-invasive methods like repositioning first when encountering poor PD drainage. Question 17. The nurse is providing education to a patient starting hemodialysis regarding fluid restrictions. Which statement by the patient indicates a need for further teaching? I should measure my urine output daily to help track my fluid intake. B. I can drink as much as I want on my dialysis days. C. I should try to avoid salty foods because they make me thirsty. D. I can suck on ice chips or hard candy to help with thirst. Answer B. I can drink as much as I want on my dialysis days. This question assesses the patient's understanding of crucial fluid restriction guidelines in hemodialysis. The phrase indicates a need for further teaching points to a misunderstanding of the concept. Fluid restrictions are necessary for most hemodialysis patients because their kidneys cannot remove excess fluid, leading to fluid overload between treatments. This restriction applies every day, regardless of whether it's a dialysis day, as the body still accumulates fluid. For example, believing dialysis days allow unlimited fluid intake can lead to dangerous fluid weight gains. Emphasize that fluid restriction is a 24/7 commitment for dialysis patients to prevent complications like shortness of breath and high blood pressure. Question 18. What is the primary role of the proportioning system in a hemodialysis machine? I. To remove air from the bloodlines before treatment. B. To mix purified water with concentrate to form dialysate. C. To monitor the patient's blood pressure during treatment. D. To warm the dialysate to body temperature. Answer B. To mix purified water with concentrate to form dialysate. This question focuses on the essential function of a specific component within the hemodialysis machine. The keyword primary role emphasizes the most critical job of the proportioning system. This system is responsible for accurately mixing the purified water from the water treatment system with the liquid dialysate concentrates, acid and bicarbonate, in precise ratios. This ensures the dialysate has the correct electrolyte composition and osmolarity required for effective and safe dialysis. For example, if the proportioning system malfunctions, the dialysate could be too concentrated or too dilute, harming the patient. Remember, the proportioning system acts as the chemist of the dialysis machine, creating the exact dialysate needed for treatment. Question 19. A patient with a newly placed arteriovenous graft, AVG, is experiencing significant swelling and a palpable thrill that extends far distally into the hand, accompanied by numbness in the fingers. This constellation of symptoms is most indicative of I. Venous hypertension. B. Steele syndrome. C. Infection. D. Pseudoaneurysm formation. Answer B. Steele syndrome. This question presents a complex clinical scenario requiring the nurse to differentiate between various vascular access complications. The keywords significant swelling, thrill that extends far distally into the hand, and numbness in the fingers are classic indicators of Steele syndrome. This occurs when blood is stolen from the distal extremity by the low-resistance AV access, leading to ischemia, lack of blood flow, in the hand and fingers. For instance, the hand might feel cold, painful, and numb because the graft is drawing too much blood away from it. When assessing a new access with distal hand symptoms, always consider Steele syndrome, as it compromises the viability of the limb. Question 20. When assessing a patient with a tunneled hemodialysis catheter, which finding would require immediate notification of the nephrologist? I. Clear, serous drainage from the exit site. B. Tenderness and purulent drainage at the exit site. C. The catheter dressing is slightly damp but intact. D. The patient reports mild discomfort during heparin lock installation. Answer B. Tenderness and purulent drainage at the exit site. This question tests the nurse's ability to identify critical signs of a central venous catheter infection. The keywords immediate notification underscore the urgency of recognizing serious complications. Tenderness and purulent, pustulant drainage at the catheter exit site are definitive signs of a local infection, which can rapidly progress to a systemic bloodstream infection, bacteremia, a life-threatening condition in dialysis patients. For example, if the catheter site looks inflamed and has pus, it indicates an infection that needs urgent medical attention. Always remember that any signs of infection at a central venous catheter site demand immediate medical evaluation to prevent severe systemic complications. Question 21. Which is the most common cause of hypotension during hemodialysis treatment? I. Myocardial infarction. B. Rapid ultrafiltration and fluid removal. C. Anaphylactic reaction to the dialyzer. D. Dialysate temperature set too low. Answer B. Rapid ultrafiltration and fluid removal. This question focuses on the most frequent cause of a common intradialytic complication. The keyword most common cause directs the answer to the most prevalent etiology. While other factors can cause hypotension, the primary reason patients experience a drop in blood pressure during hemodialysis is the rapid removal of fluid, ultrafiltration, from the intravascular compartment, leading to hypovolemia. The cardiovascular system struggles to compensate for this swift volume loss. For instance, removing 2 liters of fluid in a short time can easily cause blood pressure to drop in a patient. Always prioritize assessing the ultrafiltration rate and the patient's fluid status when hypotension occurs during dialysis. Question 22. A patient experiences sudden, severe shortness of breath, and frothy pink sputum during hemodialysis. The nurse suspects fluid overload causing pulmonary edema. What is the most appropriate initial adjustment to the dialysis prescription? I. Increase the dialysate sodium concentration. B. Decrease the ultrafiltration goal to prevent further fluid removal. C. Increase the ultrafiltration rate and possibly the total fluid removal goal. D. Administer a rapid normal saline bolus. Answer C. Increase the ultrafiltration rate and possibly the total fluid removal goal. This question tests the nurse's immediate response to a life-threatening complication, specifically pulmonary edema due to fluid overload during dialysis. The keywords sudden severe shortness of breath, frothy pink sputum, and fluid overload causing pulmonary edema clearly indicate the patient needs rapid fluid removal. Therefore, the initial adjustment to address this is to increase the ultrafiltration rate and potentially the overall fluid removal goal to quickly remove the excess fluid contributing to the pulmonary edema. For example, if a patient is drowning in their own fluid, the machine needs to pull that fluid off faster. Remember, acute pulmonary edema in dialysis patients requires urgent and aggressive fluid removal. Question 23. What is the recommended minimum blood flow rate for an arteriovenous fistula, AVF, to achieve adequate hemodialysis without excessive recirculation? I. 150 milliliters per minute. B. 200 milliliters per minute. C. 300 milliliters per minute. D. 400 milliliters per minute. Answer C. 300 milliliters per minute. This question tests knowledge of optimal hemodialysis parameters, specifically regarding vascular access function. The keywords recommended minimum blood flow rate and adequate hemodialysis without excessive recirculation point to the ideal operational efficiency for an AVF. While specific rates can vary slightly by patient and access, a blood flow rate of at least 300 milliliters per minute is generally considered the minimum for an AVF to achieve effective dialysis clearance and minimize recirculation of dialyzed blood back into the arterial line. For example, running a fistula at less than 300 milliliters per minute often means the treatment won't be as effective. Always aim for a blood flow rate of at least 300 milliliters per minute for a functioning AVF to ensure good treatment adequacy. Question 24. A patient receiving hemodialysis develops severe itching, bone pain, and muscle weakness. Laboratory tests show elevated parathyroid hormone, PTH, and phosphorus levels. These findings are most consistent with which complication? I. Uremic neuropathy. B. Renal osteodystrophy. C. Dialysis-related amyloidosis. D. Cardiovascular disease. Answer B. Renal osteodystrophy. This question assesses the nurse's understanding of the complex musculoskeletal and endocrine complications of ESRD. The keywords severe itching, bone pain, muscle weakness, and elevated parathyroid hormone, PTH, and phosphorus levels are classic indicators of renal osteodystrophy. This condition encompasses a group of bone disorders that develop in patients with chronic kidney disease, primarily due to imbalances in calcium, phosphorus, and PTH metabolism. For instance, high phosphorus and PTH can lead to weak, painful bones. Recognize that these combined symptoms and lab values strongly point towards bone disease in dialysis patients. Question 25. Which of the following is the most effective method for preventing bloodstream infections in hemodialysis patients with central venous catheters, CVCs? I. Routine prophylactic antibiotic administration. B. Daily dressing changes with a non-sterile technique. C. Strict adherence to a septic technique during catheter access and dressing changes. D. Frequent flushing of the catheter with saline only. Answer C. Strict adherence to a septic technique during catheter access and dressing changes. This question focuses on a critical aspect of patient safety in dialysis, preventing central venous catheter infections. The keyword most effective method emphasizes the highest impact intervention. Strict aseptic technique, which involves meticulous hand hygiene, sterile gloves, masks, and sterile field practices during any manipulation of the catheter or dressing changes, is paramount in preventing microorganisms from entering the bloodstream via the catheter. For example, when you change a catheter dressing, using sterile gloves and maintaining a sterile field drastically reduces infection risk. Always remember that strict aseptic technique is the cornerstone of preventing catheter-related bloodstream infections. Question 26. A patient on hemodialysis reports increasing fatigue, shortness of breath on exertion, and cold intolerance. Their hemoglobin is 8.0 g/dl. What nutritional deficiency should the nurse suspect and assess for as a potential contributor to these symptoms? I. Vitamin C deficiency. B. Folic acid deficiency. C. Iron deficiency. D. Vitamin B12 deficiency. Answer C. Iron deficiency. This question assesses the nurse's understanding of anemia management and related nutritional deficiencies in ESRD. The keywords increasing fatigue, shortness of breath on exertion, cold intolerance, and hemoglobin is 8.0 g/dl all point to anemia. In dialysis patients, iron deficiency is a very common and significant contributor to anemia, often requiring both oral and intravenous iron supplementation alongside ESAs. For instance, a patient might not have enough iron to make red blood cells, even with erythropoietin. Remember to always consider and assess for iron deficiency when a dialysis patient presents with symptoms of anemia. Question 27. The primary goal of continuous renal replacement therapy, CRRT, compared to intermittent hemodialysis for critically ill patients with acute kidney injury is I. More rapid correction of fluid and electrolyte imbalances. B. Better removal of middle molecule toxins. C. Slower, more continuous fluid and solute removal, leading to greater hemodynamic stability. D. Reduced need for anticoagulation. Answer C. Slower, more continuous fluid and solute removal, leading to greater hemodynamic stability. This question tests the understanding of different dialysis modalities and their specific advantages in certain patient populations. The keyword primary goal and critically ill patients with acute kidney injury highlight the unique benefits of CRRT. Critically ill patients, especially those who are hemodynamically unstable, g. hypotensive on vasopressors, often cannot tolerate the rapid fluid and solute shifts associated with intermittent hemodialysis. CRRT provides a gentler, continuous process that minimizes these shifts, leading to much greater hemodynamic stability and better tolerance in unstable patients. For example, a patient in septic shock might not survive the rapid fluid removal of regular dialysis, making CRRT the safer choice. Understand that CRRT is preferred for unstable patients precisely because of its slower, gentler approach to fluid and waste removal. Question 28. Which of the following dialysate solutions is typically used in the majority of modern hemodialysis treatments? I. Acetate dialysate. B. Bicarbonate dialysate. C. Glucose-only dialysate. D. Saline-only dialysate. Answer B. Bicarbonate dialysate. This question tests knowledge of standard dialysate composition in modern hemodialysis. The keyword majority of modern hemodialysis treatments points to the currently preferred and most commonly used type. Bicarbonate dialysate has largely replaced acetate dialysate because it is much better tolerated by patients, especially those who are hemodynamically unstable, and more effectively corrects metabolic acidosis. Acetate dialysate was associated with more intradialytic complications due to the slower conversion of acetate to bicarbonate in the body. For example, using bicarbonate dialysate reduces the likelihood of patients experiencing hypotension or nausea during treatment. Always remember that bicarbonate dialysate is the standard of care due to its superior patient tolerance and physiological benefits. Question 29. A hemodialysis nurse is assessing a patient's arteriovenous fistula, AVF, prior to cannulation. Which finding indicates a healthy, mature AVF suitable for immediate use? I. A soft, continuous bruit and a strong, easily compressible thrill. B. A loud, rushing bruit with a weak, discontinuous thrill. C. Absence of both a bruit and a thrill. D. Significant tenderness and warmth over the entire length of the fistula. Answer: I. A soft, continuous bruit and a strong, easily compressible thrill. This question assesses the nurse's ability to identify a properly matured and healthy AVF, a crucial skill for safe and effective cannulation. The keyword, healthy, mature AVF suitable for immediate use, highlights the characteristics of a functioning access. A soft, continuous bruit, the whooshing sound D, and a strong, easily compressible thrill, the vibration, are the hallmark signs of good blood flow and patency, indicating the fistula is ready for use. Conversely, absence of these sounds or vibrations, or signs of inflammation, indicate problems. For example, if you feel a strong vibration and hear a smooth sound, you can be confident in cannulating. Always remember that a good thrill and bruit are your best indicators of a healthy, usable fistula. Question 30. During patient education about peritonitis prevention, the nurse emphasizes the importance of meticulous hand hygiene before connecting or disconnecting peritoneal dialysis exchanges. What is the primary rationale for this emphasis? I. To prevent air from entering the peritoneal cavity. B. To reduce the risk of bloodstream infections. C. To minimize the risk of bacterial contamination of the PD catheter. D. To ensure accurate dialysate fluid balance. Answer: C. To minimize the risk of bacterial contamination of the PD catheter. This question focuses on a cornerstone of peritonitis prevention in peritoneal dialysis. The keywords meticulous hand hygiene and peritonitis prevention directly link to the primary goal. The most common cause of peritonitis is the introduction of bacteria from the patient's skin or the environment into the peritoneal cavity during connection or disconnection of the PD catheter. Meticulous hand hygiene significantly reduces the bacterial load on the hands, thereby minimizing the chance of contaminating the catheter or connection site. For instance, clean hands are the first line of defense against germs getting into the PD system. Remember, proper hand hygiene before every exchange is the single most important step in preventing peritonitis.